Welcome back to That's So Vegas. I'm Christine, your host. Thanks for sticking with us. I'm with Dr. Lynn Kowalski, and we're having a real good time talking about how women can enhance their sexual pleasure, their enjoyment. They can be beautiful from the outside in, and what you use, but there's a number of other things that you're involved in. One of the techniques that you use is a laser technology that we were talking about. You insert it. It's similar to the same that we do on our faces, and it stimulates the lining of the vagina.
Right.
So, and this is a safe procedure, I presume.
Yeah, the great thing about it is of the thousands of women who have been treated with it, no one has ever reported an adverse event. So there's never been a problem from it. Obviously, nothing is 100%. It's not going to work on everybody, but the efficacy is really high. There was a recent study that compared it to women taking hormones, and this actually worked better specifically for vaginal symptoms than the hormones did.
That's interesting because there's a lot of more, I would say, cons than pros about hormone therapy. I know several years ago women were taking a lot of estrogen and then they found that caused uterine cancer. Is that correct?
It can, but the bigger concern is breast cancer, certainly for women who take it for long periods of time. I mean, here's the thing. There's a lot of women who take hormones. I take hormones right now. You know, menopause is... It's not a great, fun thing to look forward to. I had a friend once tell me we should call it menostop instead of menopause.
I always say pause.
Pause, right. Because it's not like it pauses and then things go back to where they were. They never do.
Right.
So, you know, it's a big adjustment for women as we age. And so hormones have their place, but I have many patients who've had hormone responsive cancers. There's a lot of hormone responsive cancers out there. Breast cancers, uterine cancers, ovarian cancers, and others. Those women can't safely take hormones at all. And so the thing that's hard as a cancer doctor is, you know, a lot of times we treat the cancer, the patient's doing well, but then she's looking forward, well, what's my quality of life going to be like now? I can't have sex with my husband anymore.
That's sad.
Yeah, so, you know, I've been looking for something like this for a long time where we can do something that's safe. It's not hormonal. It's not going to affect their cancer, but it helps restore that, and then they can maybe get back to a good relationship with their husband or whoever their partner is.
The intimacy is a great part of it. And again, when you have maybe even your husband out having Viagra and, you know, their quality of sexual enhancement is, this should make older women more competitive.
Right, exactly. We need something for us. Every once in a while, we need something for us.
So what would you say on average a woman's expectancy for a happy, healthy sex life would be?
It's different with everybody. I mean, I have some women in their 80s who are still sexually active. Yeah, so
yay!
I know it's
good for you.
It's really not age dependent. I mean, a lot of it depends on your own health and your activity and fitness over your life, and the biggest thing is having the right person. So, you know, if a woman is happily married and she's been with that man for many, many years, there's no reason why things have to stop at some point. I certainly have a lot of patients where maybe they were married, their husband passed away, and now they're kind of out in the dating scene again, and they find themselves a little bit reinvigorated, rejuvenated, and their sex life has kind of come back again too. So that's another possibility. But there's no time when it has to stop.
That's interesting. I mean, and we're such a sex-oriented, driven society, I guess, but I always cracked up when I saw those Viagra commercials with the man and the woman in the bathtub.
Right.
I'm like, well, why is he in that bathtub and she's in that bathtub?
Right, they should be
just
together.
be like together in a bathtub. But those were for Viagra, I think. It had nothing to do with, you know, there are other lubricants that you buy in the store that people use, but this one actually, again, what I like about it is so natural.
Right. It's restoring the body's ability to do that for itself.
And wouldn't that help with the hormones as well? Does that help somehow stimulate any hormone?
No, it doesn't. It doesn't do anything. Basically, once your ovaries stop producing hormones, it's over. It's pretty much over. I mean, the average age of menopause that women notice is early 50s. But what we've learned more recently is that the ovaries will actually produce small amounts of hormones for many years after that. It's just not, you know, what it was when you were 25.
Right.
But as a surgeon, for example, we are now more likely to leave ovaries in, even in older women. So if a woman doesn't have cancer or there's some reason that we have to take the ovaries out, we're often recommending leaving them in longer. In the old days, every woman who underwent a hysterectomy, the doctors just took everything out.
Right.
But now we know that we probably shouldn't be doing that for everyone, and the hormones have a lot of benefits. It just depends on every woman's situation is different.
That really makes sense, when you think about it.
Right. You've got to individualize it to the patient and what's going to be best for her.
I like that too, and I know you're a very caring physician, and you do, even on your website, you were saying that you really take a personal interest in your patients, and you wouldn't just recommend this therapy to anyone if they did have a pre-existing problem or some reason not to do it.
Right.
Not bragging, but I've never had a hot flash.
Oh, you are so lucky.
I'm not bragging, but I mean, I kept going, I've had friends who literally wake up with have to ring their, I'm wondering if something's wrong with me. But
you're just, everybody's different.
Yeah, maybe
every
I'm
woman
just
feels it a little bit differently. And
I've been cranky at times, but I guess.
There you go.
Maybe that's it. I'm just so glad. Or maybe I have had one, but everybody says, oh, no, you would know if you had a hot flash.
Yeah,
so,
you know.
And well, I think a lot of women are going to be interested in hearing about this and contacting you. Do you do consultations as well for this?
Absolutely. If someone is interested, they just have to call the office. I think you have the phone number that you're going to
It should be scrolling at the bottom of the screen.
Great. Or my website is drlynkowalski.com, so people can go visit that. And there's actually more information. There's videos about the Femilift. And that also links, I have our practice website is Nevada Surgery and Cancer Care. So it's NVSCC.
And that's out in Summerlin, correct?
We're actually not too far from here, from the Strip.
Okay.
It's on the 215 in South Jones.
All right, that's easily accessible.
Yeah, we're like 2 blocks from the highway.
And no complexes out there. This isn't just for women who are over 50.
Right,
I guess that's the...
It can be any age.
Yeah, or especially if you've had difficulty in childbirth.
Right.
I hadn't even thought about that.
Yeah, it's the young women who, like I said, they especially a larger baby where things really get stretched, that can really be a problem. And like I said, a lot of women notice it first when they start going back to exercise, and they notice a huge change in what they were experiencing before, and they said, well, what can I do to get back to to where I was?
Yeah, but this seems like, again, you're stimulating nature. You're giving nature a hand, because I know there are other procedures I've read about them where people do other weird things. And I guess men are doing weird things as they get older, too, to supplement the Viagra to make themselves look firm and young. And
Right.
And
well, this is all about really collagen. Collagen is the substance that gives our skin and our tissues its tone. And, in the past, there have been techniques where people have injected collagen into the vaginal areas, like some women have gotten it to enhance their lips or something like that. It sounds kind of painful to me, and it's a little bit harder to control exactly where it goes. With this technique, basically you're stimulating the whole vagina to make new collagen, which is great.
And it is, darn it, I wish we had a little video or something. So I would say it probably looks like a hair wand.
Yeah, or like if a woman's ever had like a vaginal ultrasound, it looks very similar to the one that goes inside the vagina for an ultrasound. But again, if people go to my website, drlynkowalski.com, we've got videos and lots of information on there.
That's great. I love it. And another thing, too, I like that it is actually a good substitute for hormone therapy.
Right.
And the hysterectomy thing, that's really an interesting subject, and I know that you've written a book about that. It's called Not My Mother's Hysterectomy?
Not Your Mother's Hysterectomy.
Not Your Mother's Hysterectomy.
Right.
And I'd like to really hear a little bit more about that. We're going to talk about that in depth in the next segment. But again, it's this laser thing is cool because you're not messing with Mother Nature so much as trying to alter a balance of the hormones. You're not replacing gosh, anything could happen with hormone replacement. Couldn't you grow hair where you don't want it, or some women grow mustaches? Or
no,
something?
Not necessarily. I do have patients who are actually taking hormones, and they're still not getting the effect in that exact area, right? So the hormones might be helping them with their hot flashes or their sleep or something else, but they're still experiencing the problems with the urinary incontinence or their sex life or something, and so they're looking for this extra boost.
So in a way, this could help kind of undo a side effect of a hysterectomy, the laser, by stimulating.
Yeah, although you can use it on someone who hasn't had a hysterectomy, so it can go either way.
Interesting.
Yeah.
Boy, time flies. We have to take another break.
Okay.
Don't go away. We'll be right back. We're going to, anybody have concerns about hysterectomies, thing of that nature, and also rejuvenating your sex life. Don't go away. Big shout out to the Red Roof Inn on Paradise across Mahardwalk. We'll see you in a few minutes.